Welcome to the Daily Dose of Derm podcast, your go-to podcast for all things dermatology. I'm Dr. Mohiba Tareen, a board-certified dermatologist and the founder of Tareen Dermatology. Join us as we dive into the fascinating world of skincare, beauty, dermatologic treatment, and how to enter the world of derm. Whether you're a skincare enthusiast or an aspiring medical professional, this podcast is your daily dose of knowledge and inspiration. Get ready to uncover the secrets to healthy skin and discover how to make a meaningful impact in the field.
Welcome to the Daily Dose of Derm. My name is Natalie Bohr, and I'm filling in for our beloved Shehab Adam today. And I'm thrilled to be here with my friend and beautiful colleague, licensed esthetician and certified laser tech, Rachel Najda. Welcome, Rachel.
Thank you for having me today.
Rachel is, if I have any cosmetic or aesthetic questions, Rachel's my girl. And she has over 18 years of experience in this industry, is a wealth of knowledge, and I'm so happy to have you here. Rachel, tell everybody listening about your background.
I've been a licensed esthetician, a certified laser technician for about 18 years now. I got into this industry mostly as sort of a segue into healthcare. I knew that I wanted to work in medicine. A lot of the work that I do and the pleasure that I derive out of that work is in educating patients. I like all of the STEM categories, the science, the engineering, the technology that goes into a lot of my work, which is lasers, chemicals, the different procedures that we perform.
It's amazing. People who have seen Rachel love her. They are very loyal to her. I'm being one of them. And many of the people that work here also just think so highly of you and your expertise. So today, Rachel and I are really excited to talk about sort of this. I mean, we're both on Instagram and TikTok, and we send each other these weird videos that are on social media, kind of boasting about these skincare trends. And today we're gonna debunk them. We're gonna talk about what we see out there and why it's not worth trying or what the risks are.
Definitely.
So just last night, Rachel, I was watching this reel on Instagram of there's a dermatologist that we work with, and he was evaluating this gal's impression of her skincare routine, and she was unveiling to her followers why her skin was so glowy. And can you have a guess at what she was using for her face?
In my many years of experience, nothing is off the table. So I'm going to let you lead with that one, and then I will give my impressions.
It's an ingredient that's often used in baking. It's baking soda on the face for an exfoliant.
Yes, I would have to assume baking powder, baking soda. We see these very often, these kind of DIY mask concoctions. There's a reason that you see a board-certified dermatologist, a licensed esthetician, working in these practices. Oftentimes, these ingredients are made for baking, and not to say that they don't have utility, but when you're using something that is abrasive, what you're not seeing oftentimes, even like these pumice masks and scrubs,
yes,
they use ingredients that can really lacerate or micro-lacerate your skin, that can create inflammation. Oftentimes with these acid or alkaline agents, they can really throw off the barrier function of your skin. We see this often in patients who have dermatitis, rosacea, eczema, and even using a skincare product that's balanced with things that are known to be beneficial to your skin can still be mildly irritating for some people. So using just raw ingredients, oftentimes we run into issues with that.
I believe it, and I'm sure you've seen your own fair share of people who have come to you that have been using things like that, and yes, you help them get out of that routine.
I will have to say one of the wilder things is many, many moons ago, I had a woman, I asked her about her skincare regimen, and as we got to the end of her list, she said, I'm also using Silica 240. And I said, I'm not familiar with that product. And she said, Silica 240 sandpaper.
Oh.
It's the same as microderms.
No.
And I said, let's talk about that.
Yep.
So when you say people using things, in a DIY, there is a lot of content out there with just not good information that can really do harm to your skin.
Right. And one of the myths that I want to talk about debunking with you is more even on the service side of things. So, product and ingredients aside, let's talk about services. So people all over TikTok and Instagram and even Facebook are talking about microneedling at home.
Yes.
I mean, tell me about for anybody listening, like what's the risk here?
There are many risks involved. Not in the least is, of course, we are using single-use sterile surgical steel needles. We use a FDA-approved device, the only one, which is Skin Pen, Abellis Medical. How that particular technology works is if this is the surface of your skin, it creates these small little perforations. Think of like plugging your lawn or aerating your lawn. When you have a roller mechanism, which is typically the ones that you're going to see for home use, those are operating on a wheel mechanism that is being rolled across. When that needle goes into the surface of the skin, it's coming in at an angle, it's tearing a V shape, and it's pulling out at an angle. And so ultimately what you're doing is you're creating a larger opening or portal for bacteria. You're exciting more of a wound healing mechanism. There's a lot more inflammation, and there's potential for more scar tissue formation. And we do see that with patients. And of course, ours are single use. We are not sterilizing and reusing these.
Thank goodness.
Absolutely. If you think that soaking these rollers in a glass of rubbing alcohol, in your bathroom countertop is going to do it, that's really not the case. We do see patients coming in who have had issues with bacterial, viral infections, sensitivities to their skin. And if you were to look at the tip of this needle under a microscope, you would see that every time that it goes in and out, if you're using a solid surgical stainless steel, you're not going to have the dulling effect. Whereas with these rollers, people are using them multiple times, going back and forth, soaking them in insufficient, sterilizing, quote unquote, ingredients, and then putting them back in your skin. And even that act alone creates the dulling of the needle, which creates a lot more trauma to your skin.
It's so alarming to me. And there's a prevalence of this misinformation, I'll call it, kind of being spewed all over. So thank you for helping clear the air on that one. Let's talk about hair removal, laser hair removal, different types of hair removal. People are doing this at home. And I think that there's obviously a lot of risk here as well. But tell me about mistakes you're seeing made that are happening on the regular and what you recommend for people that are seeking hair removal and the best practices here.
Well, in our clinic, we employ a few different options. We have more long-term solutions in the form of laser hair removal. These are regulated class devices that you can't get over the counter. And the reason for that is, as I always say, liability will trump efficacy. The FDA is not going to put something in the hands of a consumer that will allow them to go, if number 2 level is good, then number 10 is best, because you are going to burn yourself. Bad things are going to happen. We do see this quite a bit. We even see it in different medical spa, unregulated sort of practices that are not physician-owned, operated dermatology or plastics clinics that end up coming here after they've sustained injuries and burns because of just an insufficient lack of education, training, certification, and those are even done by technicians, quote unquote. If you're trying to do these things at home, there are devices that are out there, and this is a question I get very often. If you're willing to invest the time, the money in a lengthy process where you're going to have to invest quite a bit of your own time to do that, you're still not going to achieve the level of efficacy and result. I equate it to teeth whitening. There's a reason that you can't buy a Zoom whitening system and do it at home, because you can do really bad things to your teeth that can cause irreparable harm and damage.
Right. And I always say too that I'm sure that many people try to do this either to save money or, whatever the reason may be, or lack of education rather. However, how much nicer is it to have somebody else doing these treatments for you so you can relax?
Well, and you're able to definitely see more improvement in a more condensed timeline. You have the assurance that you have somebody who knows what they're doing.
Exactly.
And we make it easy for you to be able to achieve the results that you want to without having to invest quite as much time, energy, money, risk potential by doing it yourself at home.
Well, and the next service, it just terrifies me that people do this at home, is dermaplaning. It's like you've got this mini knife, right? And you're going to try to get the vellus hairs off of your face. And I can imagine many people in my life, if they were try to do this, they may end up in the ER or something along those lines. But can we talk about dermaplaning?
Absolutely. There are guarded devices that, for all intents and purposes, are no better than a razor. And not to say that that's not an effective measure. It's just that you're going to see less benefit from that in regards to both the hair removal process, but also kind of the benefit of anti-aging. When we're using a surgical scalpel, it is a single blade. It is extremely, of course, sharpened, and we're using a higher quality blade than when you have these ones that have the guards. You get a closer shearing away of the hair, but it also helps to remove part of the stratum corneum, which is that outermost layer. As we age, that becomes a lot more compacted and thickened. It also, as it removes that stratum corneum, disallows that hair from becoming ingrown. So we do see a lot of patients who come to us who get KP, keratosis pilaris, which is more common on the upper arms. We see it a lot in adolescents and even in adults, and it's that rough, bumpy chicken skin. And so if you are just shearing the hair, but you're not getting rid of some of that outer layer, it's going to cause that hair to ingrow on itself, and then we can get these kind of folliculitis, razor irritated bumps. Again, back to our microneedling discussion, a lot of people are reusing these multiple times. They're putting them in their shower, you know, and they're leaving them on their countertop in the bathroom. And again, don't have the different types of sterilizing techniques and or the single-use applications like we have.
Right. And oftentimes get themselves into more issues that then, you know, they spend more time fixing the issues than actually getting it done by somebody like you.
And that's
a
kind
problem.
of the consensus in our world is that, you know, it's not cheap to be cheap. I mean, not to put a label on it, but
no, it's so true.
You are kind of rolling the dice a little bit and taking a gamble. We have phone calls every so often of people doing things on themselves that they probably should have, you know, seen a medical professional, and now they're suffering the consequences. They're spending a lot of time and money. Sometimes we have issues with patients having permanent scarring, burning, bacterial, viral infections, fungal infections because they're mishandling a lot of these devices. So ultimately speaking, you can, you know, you could change your own brake line if you wanted to at home.
Sure.
But the risk to reward ratio on that one tells me that I'm probably going to let my mechanic do it and pay them what a skilled laborer deserves to be paid for.
I 100% could not agree more. Okay, lastly, chemical peels. Chem peels are so popular. And I think what we've seen is this prevalence of chemical peels being made, these concoctions, and then, you know, people are burning their face or they're leaving it on too long. They have no clear direction on what to do other than what, you know, Sally said on TikTok or Instagram. So are they making the chemical peels and they're too powerful? Are they not powerful? What's the deal here?
There are so many different considerations that go into that. There are different classifications from very superficial, medium, and deep peels. There are ones that are over the counter, again, equitable to Crest White strips compared to your Zoom whitening.
Right.
Are they bad? No, but they're not going to put anything in the hands of consumers that is powerful enough that they can do irreparable harm to themselves. So you're going to end up spending more time, more energy, more money, and you're ultimately just not going to see the same results. So if you're looking for something that's more effective, the ones that we utilize, again, of the different strengths, they have different percentages that vary greatly, different acidity levels. Some of them are more caustic, and depending on any number of features, we use different acids therapeutically. So we have patients who have very sensitive skin conditions, dermatitis, rosacea. We are not going to use trichloroacidic acid. We are not going to use high-strength 70% glycolic acid on those skin types.
Right.
We have patients who would benefit more therapeutically from salicylic acid because it's a oil-soluble molecule that actually gets into the gland to address acne concerns and issues. So we have the expertise to go, this is what you need based on what these features are, your budget, your goals, your downtime. And so when we do a consultation, we review all of those things because if you are somebody who spends a lot of time outside, maybe for your job, it might not be appropriate to go with the most aggressive option.
Right.
If you have a specific timeline, you've got an event coming up, doing a series of lighter peels might not get you to that goal as soon as you want to.
Right. Makes sense. And also, I think to your thought about consultations is that we need to think about, and you think about this all the time, it's in your job, the type of skin, the color of the skin, all of those things will dictate what services are best for that skin type.
Absolutely. I think one of the greatest benefits, I love working here, I've been here for 10 years now, is that we invest so much in technology. We don't jump on every bandwagon that rolls through town, as you know, Nat. I mean, we vet a lot of technologies. We are constantly going to professional conferences, sitting next to the world's greatest dermatologists, learning everything that they are. And so we're always looking for whatever the next latest and greatest is. But a lot of times we, you know, we'll demo products and services and find that they may fit that category and they might might not be. And so a consultation is a really important part of that process. This is not a cookie cutter approach. We are all uniquely different human beings.
As we should be.
There are lifestyle factors, there are genetic factors. The fact that we invest so much in our technology, if a person came in for brown spots, I could probably give them about 5 different options.
Which is amazing.
And that includes, again, timeline, budget, your price point, everybody's got a budget, is a huge consideration. And then the time of year, we are not doing most laser services in the middle of summer, but if somebody has not explored the option of maybe topical skin pigment correcting ingredients, we can start with that.
That's amazing. So I want to help people listening figure out a way, or what are tips we can give them, you can give them, Rachel, on what to look out for when this misinformation is out there. Something off the top of my head is like, check your source.
Absolutely.
Right?
When I go to conferences, when I hear people speak, oftentimes they tend to shy away from sensationalism.
Yep.
If somebody truly objectively is assessing for efficacy, for safety, they will kind of self-regulate by saying, the data shows, however, take this with a grain of salt, or this is maybe specific to this demographic.
Right.
But when somebody goes, you all should be scrubbing your face with baking soda. If you're not, you're foolish. If you're making broad generalizations, that should be a bit of a red flag, because everybody's skin is completely different.
I agree 100%. So check your sources on social media, YouTube, wherever you're at. Check your sources. Stay critical and fact check. You alluded to this too.
Absolutely.
We're of the vein, see somebody that you trust, learn about them, check their credentials, fact check the information that they're saying, know your source, and then educate yourself. So how can patients or people listening here, what's the best way for them to get education? Is it just coming in for a consult? Do you have any recommendations on that?
Yeah, consultation is really the best way, because it is very personalized. It's a one-on-one approach. As I mentioned earlier, we take all of those considerations, your goals, your budget, your timeline. And if a person came in and said, I have acne scars, we could give them 5 different options. But if they're getting married in 3 months, and if they have a budget that's more flexible and open, we might go with something like CO2 laser resurfacing if they are okay with having potentially, up to a week of social downtime, but they want to see the best results in the shortest timeline.
Right.
If I have somebody who comes in who says, I'm really working with the budget, I work outside, I get a lot of sun exposure, I'm very active outdoors, we might come up with a plan that says, well, we can start with using maybe topical skincare, things that help to promote collagen. We can start on a path of microneedling, and that way we can do a series of treatments that are a more budgetable or more affordable option that we can separate over a 4 to 6 week basis in doing that full series.
I just totally love you, and I am just enamored with your knowledge, and there's no question in my mind why people love seeing you, Rachel. It's just so awesome to have you here. I want to ask you, though, just to kind of round things out, can you recall any stories or horror stories of anybody coming in with
the Silica 240.
Okay, that was pretty good.
That was a pretty, that one kind of comes to the mind. Take your pick. There's so many different things.
There's so many.
I would say the home use devices and concoctions. Yep. We've had people call who are inquiring about services to reverse injection, filler types of procedures, and they've done it on themselves. We don't know what they're using. We don't even know if we can dissolve these ingredients. There's a reason you see a board certified dermatologist. At best, you can have a poor aesthetic outcome. At worst, you could vascularly occlude, meaning you could inject into a blood vessel.
Yes, it's scary.
We don't have x-ray specs.
Yes.
Obviously, a board-certified dermatologist or facial plastic surgeon, they are well-versed in anatomy, and they know where these critical vessel structures are.
Yes.
But if you're just going willy-nilly, injecting whatever into wherever, you can have necrosis. And every time I go to derm conferences, I make a point to check the box of risk management and complication mitigation, because it is a huge reality. And back to the point of how to kind of vet a professional, these doctors go, we all know sitting here that as good as we are, that there is no guarantee that a complicating factor might not arise. So the best that you can do is assume that someday you are going to encounter that, and to have the right materials, to have the right resources, to have the right education. So knock on wood, when everything goes goes right, great. But in the 1 out of a million case when something goes sideways, you go, I know how to identify what's going on. I know how to fix it. I know the steps, and
Yes.
save patients and yourself from a lot of bad things happening.
Yes, and find somebody with experience,
Absolutely.
right? When you're looking for the person who's going to be doing your skin pen or, your filler or whoever it is, look at their credentials. How long have they been in this business? How long have they been practicing? It's so, so important.
Yeah, I am never, I don't use, I guess I will use the word offended. I'm never offended when somebody credentials me. I'm proud of being able to give them a list of my experiences, of my expertise, of my education. And that is a very important process, whether you, regardless of what type of medical professional you're seeing, you are trusting somebody with the care of your skin, your body, your health, and
Your
it's
biggest
never,
organ.
and it's exactly never the wrong answer to advocate for yourself and to ask questions. And I tell patients, if there's a procedure that I feel is better for you that we don't have here, and I can make a referral. If I don't have a referral, I tell them what questions to ask, and that's to the benefit of the patient.
Yeah, you're also their advocate, which is why you're an amazing aesthetic provider. So, okay, this has been awesome. I think that for anybody listening, the takeaways are fact check, do your research, educate yourself, but also if you're really invested in your skincare, don't you think, Rachel, the best thing to do is just get a consultation if you're interested in XYZ. Somebody like Rachel should be able to help you. And if they can't, then you're probably not in the right place. Rachel, any final words from you on recommendations for anybody listening?
I would agree with all the things that you said. It's, again, a customized approach, sitting down one-on-one. There's a reason that we don't do Groupons. We don't sell 500 units of whatever and just get people in and do the same 5-point injection technique and get them out. We want to sit down with you, and we want to know what your concerns are, what your areas of focus. We want to know, again, goals and budget and timeline and all of those things, so that we can create the right approach depending on all of those factors.
You are amazing. Thank you for being here.
Thank you for having me.
Thank you, everybody, for listening. This is the Daily Dose of Derm. Stay curious and stay inspired.